Live picture right off the top at 10 o'clock tonight. We're outside Walter Reed National Military Medical Center. This is where the president arrived earlier this evening. He is expected to spend at least the next few days here, all because of his COVID-19 diagnosis. Good evening. I'm Doug Dunbar. Good to have you. We're streaming live as we do on CBSN DFW. So since the news of the president's diagnosis broke, others have now followed suit. Tonight, that now includes former senior advisor to the president, Kellyanne Conway. She made the announcement on Twitter just a short while ago. Conway, we know, was in the second row last Saturday at the president's announcement that he was selecting Amy Coney Barrett as his Supreme Court pick. Two senators who were also there as well have also tested positive. Those are Senators Mike Lee and also Thom Tillis. Senator Mike Lee of Utah, by the way, also attended that event, and he said today confirmation that he has tested positive. As the possible COVID fallout grows from all of this, the main focus clearly is on the president. It was a little after 5 o'clock today when he walked here out of the White House, gave a thumbs up at one point, boarded Marine One, didn't need help from anybody else. He then took the very short flight from the White House over to Walter Reed National Military Medical Center in Bethesda, Maryland, and then walked on his own off the helicopter into the vehicle and then to the hospital. But just prior to leaving the White House, he took time to record this message.
I want to thank everybody for the tremendous support. I'm going to Walter Reed Hospital. I think I'm doing very well, but we're going to make sure that things work out. The First Lady is doing very well. So thank you very much. I appreciate it. I will never forget it.
And the White House says that he has mild symptoms, but out of an abundance of caution and the recommendation of his doctor and medical experts, he was taken over to Walter Reed, where he will spend a few days. Brooke Katz has been monitoring the updates in the feeds as they come in through the evening tonight, and a lot's obviously changed since the president was taken earlier. Talk to us about what you've seen through this night.
Doug, CBS News has learned the president does have a low-grade fever, and those close to him also say he is extremely tired, very fatigued. It's the most serious known medical threat to a sitting president in decades. President Trump walking out of the White House and into Marine One on the way to Walter Reed National Military Medical Center after contracting COVID-19.
I think I'm doing very well, but we're going to make sure that things work out.
President Trump is in a high-risk category for serious complications. His doctor gave the president a dose of an experimental antibody treatment by Regeneron as the president is evaluated by a team of experts. When the president revealed his diagnosis early Friday, he tweeted, "We will get through this together." Thursday, after his aide, Hope Hicks, tested positive for COVID-19, the president attended a private fundraiser in New Jersey. Wednesday, he held a Minnesota rally with minimal masks and little social distancing. Tuesday, the president shared the debate stage with Democratic nominee Joe Biden.
I don't wear masks like him. Every time you see him, he's got a mask.
But President Trump is now a patient, and the White House says he will continue to work for the next several days from the hospital's presidential offices. We do know, too, Melania Trump, First Lady, is said to be positive and have milder symptoms. She remains at the White House this evening. Meanwhile, the president's adult children are sending well wishes to their father. Eric Trump calls his father a true warrior, that he'll fight with the same strength and conviction he uses to fight for America every day. He asks everyone to pray for his recovery. And Ivanka Trump also saying, "You are a warrior and you will beat this." She says, "I love you, Dad." And Doug, I've also had conversations with local doctors. They're going to weigh in on that experimental treatment given to the president and why they say the next few days are so critical to his recovery. Doug?
Be interested in hearing more about that. We'll chat in a minute. Brooke, thank you. Meanwhile, the White House does say that President Trump remains in control of the U.S. government tonight. He's not relinquished any of his power, but considering the unpredictable nature of COVID, it's fair to raise the question, what would happen if there's a period of time that the president can't carry out his duties? Our Ken Molestina tonight with some answers.
The Constitution's 25th Amendment is what serves as the playbook for a scenario in which a president would need to cede power because of incapacitation. That's a very important word in all of this. A legal expert I spoke with reminds us it has happened before. You might recall back in 2002 and 2007 when President Bush ceded power to the vice president while undergoing colonoscopies. Ronald Reagan also did the same in the 1980s while undergoing cancer surgery. In those cases, they invoked a section of the 25th Amendment that allowed them to temporarily do it because of their incapacitations. President Trump has only reported mild symptoms of COVID-19, but should his condition worsen, SMU professor and attorney Eric Cedillo says power could be taken from him even if he doesn't concede.
And it is a process whereby vice president and a majority of the cabinet can actually declare the president may be incapacitated and notify Congress of same. Theoretically, in this situation, if President Trump were to be incapacitated and not be able to cede power, then that might be taken from him for a period of time.
We know the president will now spend the next couple of days at Walter Reed Medical Center, and the White House press secretary dispelled any rumors that the president is seriously ill.
He is hard at work. We're having to slow him down a little bit.
Cedillo says unless the president's condition worsens, none of the succession possibilities will go into effect.
If that is not the case, then I don't think anything happens. I think the president maintains the presidency. If he were to, again, lose consciousness, if he were to have to be on a ventilator or something to that effect, then I think everything changes and everything kind of moves into the direction of the vice president taking over control.
Ken Molestina, CBS 11 News.
White House officials, by the way, say that they do have mitigation plans in place should other people at the White House also test positive. And with President Trump's diagnosis, all campaign events featuring President Trump have now been postponed officially. Vice President Mike Pence, though, will continue his campaign events, we're told, after testing negative. And in addition to that, the vice president's doctor says that he does not need to quarantine because he's not come into close contact with anyone while infectious. Democratic presidential candidate Joe Biden, meanwhile, says that he got tested for COVID twice today, both of those tests coming back negative. He's also planning to continue campaigning as well, including an event today that unfolded in Grand Rapids, Michigan. And while he was there, he said that his prayers are with the president and the First Lady.
This is not a matter of politics. It's a bracing reminder to all of us that we have to take this virus seriously. It's not going away automatically. We have to do our part to be responsible.
And the Biden campaign also said that they're going to proactively remove all negative campaign ads for now. Yes, because President Trump's COVID-19 infection. So what will play out for the president over the next few days? Brooke hinted at looking into that for us, and I want to bring her back into the conversation. I know you spoke to local doctors about what to expect from their point of view, and also this experimental treatment that you had mentioned in that piece a little bit earlier. Tell us more about all that.
I did, Doug, and researchers here in North Texas have been studying the antibody treatment since back in June. As for the president and how he'll likely progress, they say it's really just too early to know.
I think over the next 24 hours, we'll need to consider whether or not to have him admitted to Walter Reed, where he could be followed a little more closely.
That was the recommendation earlier from Dr. Peter Hotez, an expert on coronavirus at Baylor College of Medicine. And as we now know, it is the path the president is taking.
If you're over 65, overweight, your risk factors are no different than someone who is of a higher socioeconomic class, a political leader. Humans are humans.
Dr. Nikhil Bayani is an infectious disease specialist with Texas Health Resources. He explained to us what the president's doctors will be watching over the coming days.
Just like with any of our other patients, they're probably watching his vital signs, blood pressure, heart rate, oxygen levels. They're also monitoring his blood count. Also, they're going to be monitoring his inflammatory markers in the blood.
We already know the president was given an experimental treatment, an antibody cocktail by Regeneron.
The president had a monoclonal antibody therapy, which is expected to decrease the amount of virus in his body, which means he is expected to have a mild illness if this treatment works.
Dr. Mezgebe Berhe with Baylor University Medical Center is leading a trial on the treatment right here in North Texas. Just a few days ago, Regeneron released some early data showing positive results.
These are the most promising therapeutics in COVID-19 disease that I can think of.
With respect to a timeline, doctors say the symptoms usually peak in 5 to 7 days, but some people do develop complications in the second week. So it's just really hard to know for sure, Doug.
Brooke Katz, thank you so much.